You didn't do your medicine training here. What brought you to Stanford? What attracted you to come here for fellowship?
So, I went to medical school at UCLA, and I also stayed there to do a combined internal medicine and pediatrics residency. And it was actually there that I got interested in the field of cardiology, but I also worked on some mobile apps on heart failure and preventive cardiology, which led me to develop a real interest in medicine and technology, including AI, big data, and precision medicine. So that particular interest is what led me to apply to and eventually choose Stanford as my first choice for cardiology fellowship.
You've gotten here. You've just completed your second year of clinical training. Tell us about your experiences with the clinical rigor at Stanford.
Overall, I feel like the clinical training at Stanford is really strong. It definitely gave me the knowledge and the tools to become an independent cardiologist, an independent clinician, but at the same time, it exposes fellows to a number of subspecialties within cardiology. So that includes electrophysiology, interventional, even structural. So I can tell you I have closed PFOs and also assisted with mitral clips. You also get exposed to cardiac imaging, including cardiac MRIs, and of course there's critical care and heart failure in our CCU rotation. There are really plenty of procedures to go around. I looked at my procedure log yesterday. I've performed over 150 caths and over 200 echoes.
You've decided to go into adult congenital heart disease, which is a real strength here. Talk to us a little bit about that decision.
Yeah, so actually when I first applied to and came here to Stanford, I was thinking of going to advanced heart failure, which I think is also a really huge strength here at Stanford. But I did do some rotations through the ACHD clinic, which is actually built into our schedule. And I also completed the ACHD elective, and both of those things really made me realize that I wanted to continue to use my pediatric training in my future career, and what better way than with adult congenital heart disease. I also think the faculty here in adult congenital heart disease is amazing. Not only are they talented in general cardiology and congenital heart disease, but also imaging, and they have been some of my favorite mentors here. I think that's actually a huge highlight and a huge benefit at Stanford is that all of the faculty here, they love to teach and they love mentoring fellows.
You were balancing a very, very busy clinical couple of years, and yet, and you also decided to do a sort of a new specialty. You pivoted to ACHD, and yet you also submitted a very nice grant, and we're all hopeful that it's going to get funded. Tell us a little bit about your planned research career.
My research is on the early detection of right heart failure in tetralogy of Fallot patients using cardiac MRIs and stress echo. So the wonderful thing about Stanford is its close proximity and its collaboration with the School of Medicine and the undergraduate university. So I'm working with Dr. Daniel Bernstein. He's an RV expert here at Stanford. I'm also working with Dr. Allison Marsden. She's also an expert in cardiac blood flow simulation. And together with their help, I'll be analyzing the flow fields and the turbulence using computational modeling of the right ventricle on 4D flow and cardiac MRI. This is incredibly unique. I think there are very few people in the country who can do what Dr. Marsden's lab can do with computational flow modeling of the heart. And so I'm really excited about the research I'm going to be doing this year.
What have you liked about Northern California? You're from Southern California. You're now in the Bay Area. What's been your experience up here?
Yeah, I think it's not that different. I think the weather is still really great up here. I think there is a lot more outdoors things to do up here, a lot more hiking. And I think, I dragged my husband up here from Southern California. We had no family and no friends up here. But I have to say in the 2 years that I've been here, we've really enjoyed meeting a lot of different people through Stanford, and my co-fellows are some of the most outstanding people ever, and I've really met a lot of great people who will probably be part of my friends and family for the rest of my life.
I've been really impressed with your class overall, in particular because of what you did and how you came together during COVID. Talk a little bit about your experiences, during this unprecedented time, and what's impressed you about your current fellowship class.
As I already alluded to, I love my fellowship class. Really outstanding, hardworking, very smart, humble group of people. But not just my class, but also the upper class and the lower class. Um, I would say that COVID has been challenging for everybody. We really anticipated that there were going to be a lot of changes in the schedule if people, got sick or had, family or personal matters to deal with. And I think everyone really stepped up and was willing to step in and help out where in whatever capacity that they could.
Dr. Wu, I've asked you the questions that I really wanted to ask. Is there anything else that you wanted to add?
I think that there are a couple of things I want to highlight about our fellowship. I think, one thing is that, like I mentioned, our clinical training is incredibly strong, but I do want to highlight that my favorite rotation, my favorite teaching rotation so far has been the CCU for a number of reasons. Like our attendings in the CCU are incredibly smart. They're wonderful people. They love to teach. There's a lot of high-yield learning on the rotation. And then there's also the opportunity to teach other people. So you get to teach residents, you get to teach medical students. There's also very interesting clinical cases. There are a lot of things we see here at Stanford that you might not see at other universities or other hospitals. So I wanted to just highlight that rotation. I think the other thing I wanted to add is, one of the things that really drew me to Stanford as well was the interview here. I didn't expect to meet so many smart faculty who were so productive in their research, but also just really humble about it. And I realized that I wanted to model myself after them after meeting them. And so that really factored into my decision to make Stanford #1 on my rank list.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.